Hi, my name is Brody DeLoyan,
And I'm Aaron Cantu.
and our project was on the coronavirus. So we have data showing the number of Americans that were infected and, and the number that died. Millions were affected during COVID and hundreds of thousands died from it. But many other people were affected indirectly through economic shutdowns, anxiety and depression rates, and unemployment.
So our first research question was, how great was the change in anxiety and depression rates from the before the rise of COVID and during the shutdowns? So what were the differences? So if we look at our graphs before the pandemic, we got this from the CDC website. If we look at our graphs before the pandemic, it shows that mainly the Middle East is the most depressed. And then if we look at our graphs from after or during the COVID pandemic, it shows that California, Nevada, the Western area, and Texas, they both seem to be very more anxious about the pandemic. So during our methods and results, we couldn't find any data about suicide rates or depression during the pandemic. So we've mainly focused on anxiety. So we studied relevant knowledge in the mental health of Americans before and during the pandemic. Anxiety data could be found as early as March 2nd, which was really good on our part for the research. And then again, the West Coast and the Central region were the most depressed areas during the month of March. California progressed from the least depressed to the most depressed, and Arizona from the most depressed to the least depressed. So this shows that anxiety was affecting the states that were really strict on their protocols during the pandemic, and the states that were the least depressed or the least anxious were usually very loose on their protocols.
Our second research question was, how severe was the economic fallout in poor communities due to job loss during the COVID-19 pandemic? So we have some graphs here from the Pew Research Center showing the fact that a lot of the hardship was in communities that had lost a job or wages. Families that had lost a job or wages in their household had the hardest time dealing with paying bills every month. Almost 4 in 10 adults said that someone in their household had lost a job or wages due to COVID-19. And then this on the far right shows it shows how these were spread out between races and income. So economic fallout, this graph on the left shows the economic fallout in each community by class. Over half of the lower income families reported having a job loss in their family, and a lot of the policies that were used to control COVID-19 and lower the death rates negatively affected struggling communities in a lot of other ways. Poor families were much less financially secure than they already were, and over half of low-income families were unable to pay their bills in full. 3/4 of them reported that they didn't have access to rainy day funds, and it wasn't only in poor communities. 32% of upper income families also reported job loss, and a quarter of upper income families said that they were also unable to pay bills for the next 3 months on current savings. Methods and results. So it shows that families in poor communities had it the worst. All this data was compiled by the Research Center, the Pew Research Center, and graphed to see how greatly each community was affected and what that meant for the families surveyed. Like I said, over half of the families surveyed in poor communities reported having a family member in their household lose a job due to COVID. Under 25% of those families reported that they had enough money to last them 3 months to pay their bills, and almost half reported that they couldn't afford to pay their monthly bills this month. And that's it.